হ্যালো, হ্যালো, হ্যালো ইন্দ্রনীল। হ্যাঁ,
হ্যাঁ
শোনা
স্যার।
যাচ্ছে না? হ্যাঁ, দেবযানী শোনা যাচ্ছে তো?
হ্যাঁ, হ্যাঁ শোনা যাচ্ছে, ঠিক আছে।
দেবযানী শোনা যাচ্ছে? ঠিক আছে।
Hello and good evening, everyone. My name is Devjani Ganguly, and I'm a healthcare and hospital quality professional and will be responsible for hosting this webinar today. COVID concerns, our answers. This webinar has been organized by Magnox Technologies Private Limited. COVID-19 has continued relentlessly for the last 1.5 years. We all are in the middle of a crisis. The uncertainty about the future, what lies ahead of us, worries related to childcare, elderly parents, finances, job security had disrupted our routines, our lifestyle, and mental health too. A devastating second wave of coronavirus in India has seen hospitals and crematoriums overwhelmed and widespread shortage of oxygen and life-saving medicines everywhere. As of 10th July 2021, corona has affected 3.08 crores of people with 4 lakh deaths in India alone. Every day, around 41,000 new cases are being reported and around 8 to 900 average deaths. The ceaseless news coverage, the constant social media driven flood of information and misinformation has increased our sense of anxiety. This webinar is to address the concerns and to give you the realistic answers from the eminent doctors of the city who are treating it. It is a new virus never seen before. So, yes, the answers are also evolving, but our purpose is to get you the best possible information. And joining me today is Dr. Shujar Ranjan Dev, an emergency medicine and general medicine practitioner and Deputy Medical Director of Ruby General Hospital. The topic of his discussion is Checkmate COVID-19. Dr. Dev, welcome to the webinar, sir. And also joining us today is Dr. Indranil Mitra, the consultant in charge, Department of Emergency Medicine, Ruby General Hospital. The topic of his discussion is current trends in COVID-19. Welcome, Dr. Mitra. I'd just like to add that the way we proceed with the webinar today is that you both will present informative and interesting topics one by one in session of 15 minutes each. And then we will have the last session based on question answers. Now I will request Dr. Indranil Mitra to speak on his topic, current trends in COVID-19. Over to you, sir. Thank you.
Good evening, and thank you very much for having me in your show. The topic to be discussed is very apt, as it has been almost more than 1.5 years after the first case of COVID was recorded, and we are still living with it. It still looms at large. If you look at the statistics, almost almost all of the global population has already been affected. We had two waves. The first one peaked in mid-July 2020, and we have recently crossed the second peak in April 2021. So in the second wave, the middle-age group were majorly affected. We have seen a lot of deaths in the young adults and still don't know what is in store for us in near future. So if you look at the COVID bulletin of the government of West Bengal, the COVID fatality rates have still not come down. The major comorbidities that has been seen and documented among the fatal cases were that of hypertension and diabetes mellitus. So where do we stand? So in order to understand this disease dynamics, we have to understand some basic principles of epidemiology and public health so that we can understand and have a clear pathway in near future. So some topics like what is disease, what is an epidemic, what is an pandemic would give you some insight about what we are dealing with. So firstly, if I tell what is a disease, it's a composition of three factors. One, the agent; two, the host; and three, the environment. Now, agent in COVID is obviously SARS-CoV-2 virus, and host is the man, and the environment is, say, a conducive environment for transmission of the virus. If you are talking about the transmission of the virus, it mainly spreads through droplet infections and aerosols. So, having said this, what is a disease and the concept of agent, host, and environment, it's in popular terms known as an epidemiological triad in the field of public health. Now, when this disease occurs in a large number of people in a particular community, it gives rise to what is known as an epidemic. And when this epidemic crosses the boundaries of states, the countries, and continents, so then it gives rise to what is known as a pandemic. Now, the World Health Organization has declared this COVID to be a pandemic in March 20, 2020. So, if you want to understand a pandemic or an epidemic, you need to understand the natural history of that. Natural history means what is naturally going to happen if we don't intervene. So, usually, an epidemic kind of stays for some time, and after a certain period of time, according to the potency of the virus and the public health measures taken, uh, it dies down, and that's it. Now, if you look at the pattern, there might be some peaks, there might be some troughs, and this happens as the variance of the virus or a variance of the agent comes up. So, what do you mean by variance? Variants occur, say, in case of SARS-CoV-2, the virus genome changes. And when the virus genome changes its molecule due to some faulty mutations, it gives rise to variants. Now, there are lots of variants, say alpha, beta, gamma, delta, kappa, lambda. Now, which one to deal with? So, what are the variants of interest? The World Health Organization has coined this term VOI, that is called the variants of interest. That means, say, only these particular variants are of interest to us because it has the capability of infecting the human beings, and naturally it has some effect on the epidemic curves. Now, with these attacks of variants, the epidemic curve peaks and troughs, and if we kind of have robust public healthcare system, the epidemic naturally dies down. Now, if the epidemic stays there for a long period of time, the fate would be that eventually it would die down in some places, but it will remain in some pockets, and those pockets would be known as endemic zones. So each endemic zone, each pocket is again capable of flaring up and form an epidemic again. So if we think in these terms, it's really disheartening what has happened. We have only come across only 15% of the world's global population. We have been able to vaccinate, and still countries like India, which have huge population densities, are the population has the vaccination has to reach to each and every nook and corner of the society. Now, if we think of these peaks and troughs, So if you'll think that a third wave is coming, you're not wrong. You can expect a third wave, you can expect a fourth wave, and you don't know when the virus loses its potency and eventually dies down. And fingers crossed, hopefully, say it doesn't stay in endemic zones. Now, will children be affected? Frankly, the answer is I don't know. It has been seen in the first wave of COVID, elderly were mostly affected. In the second wave, middle age groups were also majorly affected, though the case fatality rates were higher in 75 and years and above. Now, if you see that, the children are the only age group who are not vaccinated. So, uh, Dr. Deb sir would next discuss about checkmating the COVID in terms of what needs to be done in order to check these things. So, lastly, uh, there's nothing to panic about, but we need to know some data that is this COVID really so bad that we cannot manage it up? It's absolutely no. If you look at the data, more people, more than COVID, about more than 1.5 million people are dying of cancers. More people are dying of HIV. More people are dying due to alcohol abuse. More people are dying due to suicides. And if you look at the COVID itself, 81%, about 81% cases are mild, about 14% would be moderate, 5% would be critical. So, swine flu, when it came, the case fatality rates were about 28%. And when you look at COVID, the fatality rate is only 2%. So, if you look at these sort of data, it's kind of a good thing that we can, it gives you a moral boost and it helps you to understand that we can beat COVID in, in by taking proper public health measures. The robust vaccination system has to come up. We need to kind of put into forefront the people who are actually learned in these things, that are public health experts. These public health experts should come up and actually address this. The government officials can take help from public health experts, and they can really uh, involve them and to uh, in different to various levels of prevention, and COVID can be contained. Thank you very much. Over to you, Mrs. Devjani.
Thank you, sir. The way you speak about the disease from public health point of view was really unique. And as whether it is the experts or us, the general public, we all are trying to learn under real life conditions. So the situations are tough. Now I will request Dr. Shujar Ranjan Deb to enrich us with his topic on discussion, Checkmate COVID-19.
A very good evening to all of you. I think this is a learning session for all of us. Indranil has really touched the very important points and sort of given us an output on the data. So now coming to why COVID-19 or the so-called the SARS-CoV-2 is so worrying us and why it is so dangerous for us. So now we have to find out that where can we checkmate COVID-19? And the virus is a very smart virus, very smart virus. It catches the susceptible host, the human beings, and the worst part is that the transmissibility is very high. Just to give an example, that the virus which used to infect 3 hosts at a time, it has changed its variants and is mutant and can cause 13 persons, infect 13 persons at one go. So it's really dangerous in one sense that if the virus is allowed to uh, grow, it can infect in huge numbers. The in multipliers it can infect. Now, so what is the where can we checkmate this? So as you understand the behavior of the virus, it has the capacity to spread. So we can't do anything to that. Now, we are a susceptible host. So who are susceptible hosts? The persons who are not vaccinated and persons who are not infected with COVID. Because persons who are vaccinated and infected with COVID are somehow not so much susceptible to the host. But persons who are not vaccinated or not infected, they are more susceptible to the host. Now, previously in the last COVID session, it was mandated by the all the health experts that the young generation should get infected so that they create a herd immunity in the society. But somehow that did not happen, and we had to face the second wave. Now, coming to the where can we checkmate? We can checkmate on the is the as on the person in the susceptibility of the host and opportunities. Now, we cannot do anything about the behavior of the virus or the transmissibility. Where we can checkmate is this: we can be prevent the susceptible host and the opportunity can be checkmate. Now, what needs to be done? So we are always listening to that wear masks, wear this type of mask, N95, various types of masks. But the point is that we are not wearing the masks properly. The masks are hanging below the chin or below the nose. Please take a pledge. Let us take a pledge that we as a common man entrust the society that we should wear masks properly. The nose and the face has to be covered. The nose and the mouth has to be covered. Please understand, we if we don't do this, we are allowing the virus to infect us, so making us more susceptible. So wearing masks is a very important thing. Now, as you understand, we have to go for our livelihoods. So mask is a very important thing, and if we don't do that, we have to suffer. And now coming to the worrying part of this is that the children suffer the most, because what happens? The parents carry the infection back home. Children, when they are infected, they are of mild variety. But the sad part is that they have a post-COVID sequelae, which is called the hyperimmune syndrome and is commonly called as the multi-inflammatory system inflammation for children, MISC. So we'll come to that in later discussion. So please understand that we sometimes get very jittery. Other day I was reading in the newspaper, we want to have revenge travel. Last time we saw in Manali, we saw a snap that huge crowd was there in Manali. Now people think that the lockdown has opened up, these tours have started, the hill stations are opening, but please understand that this we are not yet down. Till today, I was going to the statistics, 46,000 people are still infected today. So in India, so the virus is not yet gone today, and the death is also high. So we have to understand that the wearing of masks, and next is coming is the hand washing. Now, hand washing, if you consider in a day to day, at least say for 8 hours, you have to at least wash 50 times your hand. Otherwise, that is not a proper hand wash. So please understand that you have to make a sort of a bad habit of washing your hands or using the hand sanitizers at least 50 times in an 8 hours schedule. So that is the requirement to prevent this COVID virus. Because the COVID virus, the problem is in a family, if the COVID is infected, we have seen the husband is spared, the wife is ventilated, the children have mild symptoms, and sometimes we see that the people dying of that. So you never know the virulence of the viruses. So how does it infect and what does it happen? Now, as we see the 1918 swine flu, this pandemic of this flu curve, the linearity curve is dangerous. It's always in a wave form. When now it is in a linear stage, this is dangerous because we try to change our habits. We try to become more succumb to this non practicing of the hand hygiene, non practicing of the mask. We feel very relaxed, and then we spread the infection. So please understand, we are not prepared. Our houses are not prepared for COVID separation or COVID isolation. Our offices are not prepared. Our workplaces are not prepared. Even our hospitals are not prepared. We for handling these COVIDs because we didn't build the hospital the way the COVID wants the to be. The emergencies, we didn't build the emergency in that way. So please understand that an emergencies we have seen the second wave are over flooded with patients, ambulances lined up, patients dying in ambulances. It was a sorry state of affairs. But the only good part of the story is that if we practice hand hygiene and the mask, we are almost 80% safe. Now, coming to the vaccination part, which is a very, very important part of the checkmate of COVID 19. Thankfully, the world has come with a lot of vaccines, and in India we have the Covishield, the Covaxin, and the Sputnik has come to India now, and we are waiting for the other vaccines like Pfizer and the Moderna vaccines also in lined up. But please understand, please promote, take us out of our interest or a pledge that we ask the people to get vaccinated. The parents, the mothers should be vaccinated very, very fast because they stay with the children maximum time. So please promote, support the system that they get vaccinated very, very fast because if children, because we have seen in recent times, the number of children coming to the hospital has grown up. Our emergencies are getting filled up with children from 5 days old to say 15-year-old. So please, we take the message that we get ourselves vaccinated, and we have seen there's a skewed variance in the male is to female vaccination. Males are more vaccinated, females are not yet vaccinated. So please promote the female vaccination drive, and I'm assuring you that vaccinations are safe. We'll come with the questions if you have questions for the different varieties of vaccination or what are the conditions we should vaccinate or not vaccinate. We'll come to that in the question and answer session. Now, coming to that, we are also, when we talk of checkmate of this COVID-19 virus, is that we cannot crowd ourselves. Though the restaurants or the eateries are opened up, but please understand, if we give the opportunity to the virus to spread, then we are giving them the chance to grow and transmit in a more better way. So let us refrain from this. Let us restrict for ourselves because this year is not a very happy year for us because we are yet to see the third wave, and some of the countries have already started seeing the third wave. And the best part is that some countries have not seen the second wave. How did they do that? It's like countries like Bhutan and say Taiwan and all, they have not seen the second wave. Is only the practice of wearing the mask in a proper way and using the hand hygiene, maintaining the distance of how much possible you can do. That if you can maintain a distance of 1 meter, that will be good. Otherwise, we are going to face a serious problem in the third wave. And third wave, where it is being speculated, as the AIMS director said, and other public health experts and the IIT people have already speculated that this third wave will affect the children. We hope, we pray to God that it doesn't happen. But the way I see, and you all are seeing, the condition that we are not wearing masks, we are not wearing and we are crowding places. So let's refrain from that and also try to at least advocate these ideas to at least 10 people, so that will make a huge difference in the coming days. Thank you, Debjani.
Thank you, sir. It was really informative session, and all got to know a lot about the various myths and facts about the disease. The simple way of explaining will really help us to acquire knowledge and to fight against the pandemic COVID-19. Now, moving on to the question answer session, I'll try to put the questions to both of you according to your subject matter. Uh, as because we are already in the question for vaccination and all, so how the first question is people are saying that how effective is the vaccination and whether it will be able to control the third wave. Sir, your words on this.
Yeah, see, the Covishield vaccine. If we come to the Covishield part, the Covishield is a variety of the AstraZeneca vaccine from UK. So this vaccine has shown that the first dose of vaccination gives a sort of an immunity of about 70% for the COVID. We did a sort of small study in the Kolkata police crowd. We had done the vaccination for because they are the most people who move around the community and they are like super spreaders. So we had advocated them to get vaccinated, and we found they informed us the persons who didn't take the first dose of vaccination or missed the dose, they had the serious fatality. And they informed me that two of the senior officers have died because they said this vaccine won't work, and they have died. So it is a sort of a almost a proven thing that first dose of vaccination prevents the fatality or the seriousness of the infection, and second dose obviously will help you to prevent the vaccination, prevent the disease.
Thank you, sir. Now I'll ask Dr. Indrani Mitro. Sir, my question to you is the second wave coming to an end in India? Because and why did we see so many number of more deaths in the second wave in India?
Could you be a bit louder? I didn't hear that. Hello.
Sir, my question to you is the second wave coming to an end in India? And why did
Uh,
we see the number of deaths was far more than the first wave?
okay. So the thing is, second wave per se uh, is a kind of torch bearer for us. We've seen a lot of deaths. We've seen a lot of people, a lot of age groups coming into play. We've seen the fatality rates have gone up. And as I've told you, that in a case of any epidemic, what happens is that with time, it peaks and troughs and eventually dies down. But in case of peaks and troughs, if you want to predict a peak, we have various models in place, like mathematical models. For example, SIRS model, various model. One of them has been it has come up by IIT Kanpur. But the point is that the variables makes it harder to predict whether a third wave is coming or not. But definitely, as with this COVID, a third wave is surely coming. Maybe a fourth wave, maybe a fifth wave, we don't know. But we have to be prepared, and the public health system has to be robust enough in order to prevent this third wave. So, if we can discuss here that there are three levels of prevention in the perspective of public health. The first level says the primary prevention is health promotion and specific protection. Health promotion is what we are doing, and specific protection is vaccines. Second is early diagnosis and treatment. That means you get tested quickly and get treated quickly. And then the third comes in, and the third is disability limitation and rehabilitation. That means whatever has happened, then you rehabilitate. We have seen a lot of cases of lung fibrosis after COVID. People tend to feel breathless after some period of time, even after being infected with COVID. So, like that, you have to limit those disabilities and you have to rehabilitate. That means you can limit those disabilities, like with, say, early lung physiotherapy, early breathing exercises, and you can rehabilitate them by helping them out, say, giving oxygen and prone ventilating, and giving them conducive environments to breathe in. So I don't know whether a third wave is coming or not. UK is already seeing a third wave, but we don't know that whether third wave is coming or not. Government is trying hard. Government is trying to vaccinate people. So more people should come up and get vaccinated. Studies are being done. Policymakers are thinking of vaccinating young children in United States and other countries. 12 years and above vaccination have already been started, but we don't know. This thing is pretty new.
Right, sir. One question I have for Dr. Dev is that we are hearing a lot of cytokine storm, which is related to COVID. Is it related to COVID, sir?
Yeah, cytokine storm is all happens in all viral diseases, but in COVID we see more because there's a sort of a hyperimmune syndrome, and it causes floods with the lot of these inflammatory markers in the body, and it causes the system to collapse. The lung damage is happening, and this affects the lungs very much. The cytokine storm affects the lungs, and you can't breathe, and you have to ventilate, and even when sometimes ventilation doesn't work, you have to go see to ECMO. You have to start the ECMO process for the lung, bypassing the lung. So ECMO has to be done. So all these things happen in a cytokine storm.
Right, sir. Sir, we are hearing a lot about this MISC,
Yeah.
multi-system inflammatory syndrome in children, which is related to COVID. You were also mentioning it in your topic. So, can you please enlighten a little bit about
See,
this?
actually, I was coming to that. See, I think everybody should promote this. I think that parents should get vaccinated very, very fast, because their children, when they get COVID, they are mild in nature. But the problem is they sometimes develop hyperimmune syndrome in the body, and they affect from brain to the liver to the lungs to the heart, and even heart diseases. I think we have heard the term of Kawasaki disease. We have heard the term of their D dimer level rises to 10,000. Their NT-proBNP is a marker of heart failure. This goes to level of 35,000. Normal is around within hundreds. It goes to 35,000, and the children suffer with heart failure, kidney failure, sometimes the hepatic failure. They have to go on a dialysis and on ventilation. They have to spend, the drug therapy is very, very costly. The immunoglobulin has to be administered. So it is a very, very difficult disease to treat in the today's scenario. And if the hospitals are crowded, then I think it will be much more difficult to treat all this. So I think that the point is there, you have to checkmate very, very early, so that our children don't get this hyperimmune syndrome, or in the, popularly known as the MISC. So I think this is the right time we get prepare ourselves and advocate this idea to the maximum of the parents who have the small children and like that.
Now, I will request my participants also, if they have any questions, they can ask to Dr. Dev or Dr. Mitra. If anybody has any question, please unmute yourself.
I would like to add, I think uh, people are so getting knowledge, information about COVID and everything, but I'd like to highlight one point here is that please don't self-medicate yourself. Self-medication is really harmful, because nowadays over the counter it comes. We had if you go to the counter, they will tell you. Somebody's asking a question. They'll advise you doxycycline, steroids, and other medicines. Please don't self-medicate, because they have their own side effects. And in fact, people are getting habit of getting steroids As soon as they hear of fever, sore throat, they take steroids, and the steroids are really harmful at times and makes the treatment very very difficult at times. And also we are of the habit of taking vitamins containing zinc and a lot of iron tablets and a lot of these B complexes. Please, please don't take this because this is of no use. They don't improve your immune system. They don't support your immune system. Rather, it has a problem that you have heard the term of black fungus infection, and now these fungal infections are being they get more inflated by these vitamins because they contain a lot of these metals, zinc and iron. And the black fungus is always a misnomer because the fungus is always a white fungus, but there are iron deposited in the fungal infections, so it's called the black fungus. So please don't take iron tablets and zinc tablet. It is almost like contraindicated now. So, but the market is full of these vitamins, zinc and iron and all preparations we hear of. So I think you should refrain from that. Normal diet and normal things will help us. We have heard of people taking all the herbs, and in fact, the paper has come with a shrub called the giloi. In the North India, we heard of giloi, people taking people giloi for COVID, and they landed up in hepatic failure. And so please refrain from all these things. And this is not, there is no cure for COVID except some of the few interventions and few antivirals which have been recommended on an emergency basis. That also is not a treatment proper. They have been only recommended by the World Health Organization on an emergency basis for treatment of COVID, but there is no treatment of COVID as such. It's all supportive treatment. You have to support the lungs, you have to support the kidneys, you have to support the liver. So please, please don't overdose yourself with vitamins and other minerals.
Sir, another concern is of steam inhalation.
Yeah. So we have a tendency of taking steam inhalation. I think steam inhalation has to be very specific for specific reasons. It cannot be random and it cannot be taken by everyone, everybody, because people who are diabetic and people who are prone for not maintaining sugar, they have a tendency of fungal infection, and steam always promotes this fungal infection of the nose and the sinuses. So stimulation is not really advocated. It has to be sort of a advised by the ENT guy or the somebody who understands the ear, nose, throat part. Then only steam should. But steam should be not be a randomly thing.
Right, sir. And my question, next question is to Dr. Indrani Mangal. Um, Dr. Mitro.
Hello. Yes.
Uh,
What is the
sir,
question?
sir, do you think panic can be harmful in COVID cases?
Yes, definitely. Panic is very harmful in every case, not only in case of COVID. But the point is that since COVID affects the respiratory system, if you we are seeing patients who come in, young patients who kind of panic, and they start to have an increased respiratory rate, and eventually the lung is not providing sufficient oxygen in order to cater to the needs of the basic metabolic system. So panicking won't help, though this is perhaps a thing that mind is usually not in our control. But the point is that we have to understand it and deal with it. And instead of panicking, we can always follow, as sir said, that we try to take COVID appropriate measures. And if at all affected by COVID, we have to deal with it. And we are kind of toiling day in and day hard for the welfare of our patients, and most of our patients are getting well. So actually, the data which has been found out that treatment and symptomatic management, they are per se responding, and people are actually getting well, and they are being well catered to. So there's no need to panic, and you should have a good mental health. That's
Right.
what the thing is.
A question for Dr. Dev. What about increasing the immunity part from taking the vaccine and precautions? Like we are talking about vaccinations, we are trying to prepare, but like how do we develop our internal immunity?
I think if we can walk, the routine, we can do walking and all. And I would advise the natural way that if we can sleep some in a prone position for some time, day-to-day basis, I think that really helps, because now awake proning is advocated. So sleeping in prone position will be advantages. But I think the exercise and breathing exercises will only help to get the immunity. Otherwise, you have to add the normal diet, lot of fruits and lot of the protein containing. But that not to also too much. We are say taking lemon, overdose of vitamin C, overdose of this oranges, mosambis, and all. That also is not correct, because what happens? These fruits, they contain a lot of fructose. Now, this fructose is sugar which, while getting through the liver, it the more the fructose, the liver gets more of the load of digesting that fructose, and when doing so, it gets converted into fat also. The fructose goes in a different cycle and converts into fat, and it also increases the uric acid level. So lot of fruits is also not good in such a way that we can land up in joint pains and some other obesity, because obesity has become a big problem in the COVID times because of not moving out of rooms. We are staying with computer bound. We are only at home as advocated. So we have to also see to these factors also.
Right, sir. I think we have some question. Uh, can you
Sir,
please
what is
please
the
answer?
post-COVID precaution should be taken for a COVID patient?
Post-COVID patients, the person who gets COVID infected, for the next 3 months they have to have live a very disciplined life, because the COVID has infected your lungs are fibrosed, your heart is also not the way it should be, all organs are not. So you have to be very much disciplined in the sense that you have to have a proper diet. Don't overdo, because after COVID we sometimes have to do overdo exercises. Don't do that. Don't lift heavy objects. Sleep on time and have a normal diet and normal life, because we have seen the owner of the Indigo who had a COVID infection, and then he started cycling in a very generous way, and he succumbed to he died. So post COVID, these are the problems which happens, because you can land up in sudden respiratory failure, sudden cardiac distresses. So we have to refrain from that. So next 3 months, you have to be very lead a normal life and not too very aggressive. And the another part is that persons who are COVID infected, they can take vaccines after 90 days. So please get themselves vaccinated also after 90 days.
Thank you, sir.
Good evening, sir.
Good evening.
Yeah, actually, I wanted to ask that if a person gets infected once and after getting fully vaccinated, is there any chance to getting infected again?
Uh, it's probably no, but But if even if they get infected, that will be a very mild variety, my very mild variety. Because the problem with the virus is that they they change their pattern and the mutant strain, they get mutated very fast. So they might get infected, but the vaccines can take care of the majority of the strains available in India now.
Okay, thank you, sir.
So another like question we need to ask is that is there any situation or anywhere where people are not supposed to take the vaccine? Are there any government?
Only if they have a severe allergic disorder, proven allergic disorders, or say they had in the past allergic manifestations due to any medicine or any drug, this they are only prevented. Otherwise, there is no serious contraindication for taking vaccination.
Okay. Another thing, when there was a question that when should people with COVID-19 stop home isolation?
Yeah, it is advocated for 14 days, 14 to 17 days from the date of the infection, date of the
Okay,
positivity.
date from the positivity.
Uh, so
Sir,
they have to remain on home isolation for at least 17 days. After that, they can be in the normal life, lead normal life.
okay. Sir, do you, in this new normal going forward, when do you think it will be safe to open schools, etc.?
Schools, I think, is not the right time, and I think all the people are also concerned. They are brainstorming about opening up schools, but schools, we understand that we are not prepared. Our schools are not prepared to handle this type of this the 1 meter gap, or say all the because you have to have a lot of rooms, lot of classrooms, and a lot of bigger space, but our schools don't have that. So, and children, they will crowding is a big problem for reinfection. We are seeing crowding in this Wimbledon happening today, and the World Cup, we saw a lot of crowding. And recent past, we saw Kumbh Mela, and what we saw, people dying like anything. So schools are not yet prepared to open up because children are also not vaccinated. So I think government of India is trying very fast with a vaccine trial, Zirvox. They are coming for children, and I think hopefully in couple of months' time they'll come. And once that is ready, then the children are vaccinated, we can open up the schools.
Right,
So, but I think this is a getting a great toll on the children psychologically. Schools remaining closed.
right. Sir, is there any possibility of getting COVID in between the two dosages? Because we have heard in many cases
Yeah,
that
yeah, yeah. We do have seen patients after first dose they get COVID infection. Uh,
then what is the reason for that? Why they are
Now,
developing COVID?
because see, after vaccination, the antibody preparation takes about 2 weeks to 2 to 3 weeks time.
Okay,
So that is a sort of a window period, 2 to 3 weeks time. So this 3 weeks time is important. So if we get an infection in between, so we can get infected.
so then what will be the time frame for the next second dose if a person gets
If the
infected?
person gets again, it has to be 60 days. 60 days after the first dose of vaccination.
And how long does this antibody stays in our body? Like if we get
General
infected,
studies of Covishield and listen to the Covaxin, they have shown that it stays till 1 year, 1 year. But in USSR, in Russia, we heard about this coming up with the booster doses also. So I think booster will also come in a year's time.
okay. So, sir, are there any side effects of the vaccine?
Side effects so far has been reported only the malaise, the fever, or the sometimes improper injection. There's some bleeding in the site or the swelling in the site. Otherwise, it has not been reported any serious incident about the vaccination or any serious adverse event due to the vaccination. It's only a mild variety happening, all the malaise, fever, and headache, and something like that. Not
Later
really.
on, later on, can any side effect develop from the vaccine itself?
It is not very clear now. Not very clear now because these vaccines are all come up as an emergency approval because the vaccines have not undergone the full trial and it is on an emergency approval by the FDA and by the our in India by the DGCI. So it is yet to see what is going to happen with this vaccination. But at least the prevention of COVID is happening till date now.
It might also happen that we may require a third dose or a
Yeah, booster is in the pipeline. Booster dose in the pipeline.
okay.
People are working on that. The antibody levels and all are coming up, so they are working on that.
One question to Dr. Indranil Mitro. Sir, do you think the spike proteins of this virus is natural?
What is the question again, ma'am?
The question is that do you think that the spike proteins of this virus is natural?
Uh, Virus is a living thing. The corona per se means that the spike proteins are there. Now, whether it is natural or not, it's a very debatable question to answer in a common podium. The thing is, it has been found in Wuhan, so it's kind of we can assume that it might be a bioweapon, but I don't know. We don't have conclusive evidence for that. So it is natural or not, only time can tell you.
Right, sir. One question for Dr. Dev, sir. As you were saying that we, for immunity growth and all, and to like prevent ourselves from the infection, what we need to do is basically balance a balanced diet, balance nothing more aggressive, like too much of medication, too much of exercise, everything can be harmful in the long run. Another thing is like there is a contradiction that while exercising, whether people should wear the mask while exercising or not to do it. So what is your
Actually, the who advocates that while doing the exercise, you can remain without the mask because it causes the breathing sometimes breathing problem with the mask. So if you can maintain a distance in a sort of a common gym or something like that, if the distance is maintained of 1 meter, I think you can be without mask during the gym or exercise for that purpose.
right, sir? Okay. Uh, I think we are about time now. Thank you, Dr. Dev, Dr. Mitra, for answering those questions and for the great topic discussion. It was a pleasure to have you both with us. It was a highly informative and interesting session. Thank you so much, sir.
Thank you, Devjani, and thank you all of the participants.
Thank you.
Thank you very much.
Before we wrap up for today, we must remember that vaccines are an important tool against COVID-19, but alone they will not help stop the pandemic. Till the time the virus is with us, we must continue wearing our masks, clean hands regularly, and keep physical distance to minimize the risk. Special thanks to Magnox Technologies Private Limited, who provided us a platform to discuss regarding this COVID. Based on the participation and the responses, we will try to regularly give you updates on different topics related to health. Thank you all for joining us. Thanks to all the participants. So this now concludes our webinar. Thank you so much.